Hello, I'm Dr. Diane Vicary. The video you're about to watch describes a surgical procedure called radial keratotomy, or RK, an elective procedure used to correct or reduce nearsightedness. Before you decide to have any kind of surgery, it is important to understand the potential risks, complications and side effects. It's particularly important with elective surgery, such as RK, since your nearsightedness can also be corrected with glasses or contact lenses. The video discusses some of the most common complications and side effects people experience after the procedure, and it also gives you an idea of why people choose to have the surgery and how they feel about their decision now. I'm sure you'll have some questions after you watch the program. My office staff and I welcome further discussion. Thank you and enjoy the program.
It's been this way since I was a kid. The first thing I did in the morning was reach for my glasses before I even got out of bed. I wore contacts for years, but they began to irritate my eyes. My ophthalmologist tried fitting me with different kinds of lenses, but nothing seemed to work. Some days it was so uncomfortable, I had to wear my glasses.
People with refractive errors have relied on eyeglasses for years. More recently, a range of contact lenses have offered an alternative to glasses. To understand how glasses and contacts work, you need to know how the eye sees. Light rays enter the eye through the cornea and the lens, which focus the light on the retina. Assuming the eye is shaped correctly, the world appears clear and sharp. But not everyone's eyes are shaped correctly. Nearsightedness, or myopia, means the eye is too long or the cornea curved too much. Here the light rays focus in front of the retina and distant objects appear to be out of focus. That's where the glasses and contacts come in. By putting a corrective lens in front of an elongated eye, light can be refocused to fall correctly on the retina. The world appears sharp again.
Okay, you can sit back now. Well, it looks like your eyes have developed a very low tolerance to contacts. It's not that uncommon. We've tried several types of lenses, Mary, and I'm afraid you're just not able to tolerate contacts.
But why not? I used to be able to wear contacts just fine.
Some people develop this reaction over time. You can continue to wear your contacts if you can put up with irritation, or just wear your glasses.
I'm fed up with wearing glasses. And now without the contacts, I'm really active. A friend of mine had eye surgery and doesn't need to wear glasses anymore.
Well, it is something you could consider to improve your vision without wearing glasses for many of your activities.
Well, I'm not wild about the thought of surgery, but I would like to find out more about it.
It's called radial keratotomy, or RK. And I wouldn't recommend it to correct very high myopia, but actually you would be a good candidate.
Well, how safe is it?
Thousands and thousands of people have had it done, and the rate of serious complications is very low. You should take this home and read it, and then if you wish, we could discuss it further.
The idea of surgery on my eyes.
It's not a major hospital surgery, although it is a very precise operation done underneath a microscope. RK is an outpatient procedure. Afterwards, you go home.
Will I be put to sleep?
No. There are no shots and you're not put to sleep. We use eye drops to numb your eyes. Let me explain how refractive surgery works, and then you can take some time to think it over, including the possible risks and side effects.
Radial keratotomy is a procedure that can improve or correct some people's vision problems. While glasses and contacts refocus light rays before they enter the eye, RK changes the shape of the cornea itself, so that corrective lenses may not be needed for many activities. the surgeon makes tiny incisions into the cornea in a radial or spoke-like pattern. As these incisions heal, the curve of the cornea flattens out and light rays focus closer to the retina. Before you decide to have refractive surgery, you should ask yourself, are you dissatisfied with glasses or contacts? Are you prepared to accept the potential risks and side effects of the procedure? Can RK adequately correct your degree of myopia? Some people may need a second surgery to reach the degree of correction they desire. You should discuss all of these questions with your ophthalmologist before you decide to have surgery. Anyone considering this procedure needs to know about the possible side effects. Serious complications from refractive surgery are rare. You need to be completely informed before deciding to have refractive surgery, and your ophthalmologist will give you the facts. Ask questions. Realistic expectations play a big role in your satisfaction with the procedure. Let's start with the side effects. Keep in mind there may be some temporary pain or discomfort immediately after surgery. Some patients find their eyes are very sensitive to light right after the surgery. And one commonly reported side effect is a starburst pattern around bright objects, especially at night. Also, people who are considering this procedure may still need to wear corrective lenses after surgery for best distance vision or for reading, especially as they get older. RK does not alter the aging process. After refractive surgery, many people are unable to wear contact lenses again. After surgery, the cornea is weakened and may be more vulnerable to rupture if struck directly. Sometimes additional refractive surgery is necessary for best results. Every precaution is taken during the procedure so that infection is rare, but an infection could cause decreased vision. Also keep in mind that many thousands of patients have had refractive surgery, and the vast majority are very happy with the procedure. In fact, 90% of those who are good candidates for refractive surgery can pass a standard driver's vision exam without the help of corrective lenses. But remember, the visual outcome for any one person cannot be guaranteed.
Well, before the surgery, I used to wear these big, thick glasses. I guess that kind of prompted me to go ahead and get radial keratotomy once I learned more about the procedure. My doctor did tell me about the risk and side effects of RK. After the first surgery on my eyes, I was seeing 20/20, maybe a little bit better. And then after that, my eyes regressed. I went a second time to get the procedure done. My eyes regressed a little bit and stabilized at 20/40. That's what I see right now. That's good enough to pass a driving test. I would evaluate the RK procedure on a scale of 1 to 10. I would give it 10. I would definitely recommend it to anyone that has nearsightedness or myopia.
Before I had the RK, the ophthalmologist, he warned me that at some point I would probably need reading glasses, although I haven't had that need yet. I had one eye done at a time. They don't really even put you out, so I kind of saw it happening as it was happening. My second eye had almost no discomfort. It was just so easy I couldn't believe it. Yeah, I did have a very strong starburst at night from auto headlights, and that very gradually diminished. I think it took months to go away. I forget that I've had the surgery. I forget that I was ever nearsighted. So I love that. Of course, you want to investigate it. You want to feel comfortable with it. It was inconvenient for a few weeks, and it affected the rest of my life in a positive way.
Well, my vision before the RK operation was very bad and getting worse all the time. The doctor told me at first that because my eyes were so bad that I probably would still end up wearing glasses. But I didn't care really if they were improved enough so that the glasses were light. The doctor prior to the operation explained to me that what the procedures were and the fact that in some cases it didn't work. The operation was painless. I couldn't feel anything. I got up the next morning and I could see quite well out of the right eye. Well, now, after both operations have been completed, I can even drive without glasses now if it's bright daylight. The fact that I wear them sometimes at a distance is no problem with me. I certainly would recommend for anyone to at least consult with a doctor and get the doctor's opinion on it.
It's great. When I wake up in the morning, I can see. I don't have to grope for my glasses or deal with contacts. Having clearer vision has really improved my life. It's hard for anyone who doesn't need glasses to understand, but good eyesight is so basic to living, it's easy to take for granted. Radial keratotomy is not for everyone. That's why I got the facts. I asked my ophthalmologist about radial keratotomy and decided to go for it. It was the right decision for me.
Surgery, contact lenses, and glasses to correct refractive errors each have their benefits and drawbacks. The best method for correcting your vision should be decided after a thorough examination and discussion with your ophthalmologist.